This is the 7th day of the ongoing impasse between resident doctors across Nigeria and the federal government over unmet demands and unpaid wages arrears over the last 2 years. As the doctors put down their tools, awaiting government's response, these patients are left unattended and in need of urgent medical care.
We believe that with the current state of things in this country, the resident doctor is not giving his best to the patient. So already the oath is broken to even start with. So it's not just about that. We're protecting these patients. It's better we come back, fully prepared and fully ready, mentally sound, to look at these patients and give them the best than to be at the field now and giving them just half of what we know. We're better than that. The government is the only person to serve us. And then the media, as well as the patients, also have the responsibility of actually pushing this narrative to the government to ensure that these issues are resolved.
The management of the University of JUTH Teaching Hospital says they are overwhelmed by the absence of the doctors who play an important role in the hospital, constituting a large percentage of their staff.
Our health system is already running on a negative. All right, a lot of doctors are leaving. I sit here and I see resignations, and if you have a system that is already in the negative and you still have part of that system affected by a very huge quantum of doctors, definitely, the system will not be normal again. It's my hope that this doesn't drag long, that we will make this strike as short as possible.
Left to suffer the effect of this impasse are patients who, despite the strike, still come to the hospital hoping to get treated.
I feel so bad. I was not happy the way I see the hospitals today. Government should do something to this.
Kinganto ya zai da wanda ba su da lafiya kenan. Ya zai da su kinga abun din bai yi ba. Muna roƙon government su taimake mu. Su taimake mu irin wannan haka. Kamar wani zai zo asibiti sai a ce ana strike. Kingan sai a rasa yanda za yi.
This is the surgical outpatient department, and before now it used to be like a beehive of activities. But what you can see behind me now is just like a shadow of itself, where you can barely see people here, patients waiting to see their doctors for treatments. How this strike comes to an end and when is what nobody knows. But the prayers of these patients is that people will come to their aid, government as well as the doctors, so they can live again. From the JUTH University Teaching Hospital in Plateau State for News Central, Chizoba, Anionwe.